Hello, everybody. Hello, everybody. Hello, everyone. Good morning, good afternoon, good evening. My name is Luisa Ortiz Perez, and this is an absolute joy. I am surrounded on this call by esteemed colleagues, friends, and partners in crime. And well, this is a very special time for us. Um, my role in this journey and my role in this particular event is not only to introduce my colleagues, but also to guide you through one of our real firsts, which is our first presentation of the results of a survey. We had the joy of not only presenting and designing, but also analyzing since this fall on the state of mental health for journalists in the United States. And this is part of the Media Resilience Network, or MDRnet as we call it, an initiative powered by Vita-Activa and sponsored and funded by the Press Forward Initiative. So with me today in this call is Dagmar Thiel, my partner in crime and also capacity building manager at the MDRnet.
Hello, how are you doing, everybody? Thank you so much for being here. Thank you for joining us on this space. I'm responsible of capacity building at MDRnet, and I'm happy that we're launching this study. I do have a cold. Fortunately, this virus does not spread online, so you're all safe to go. And I thank you, Luisa, for taking over all the presentation because I'm not sure if I can do it with my voice. But thank you all, everybody, for being here today.
Hang in there, Dagmar. I'm sure that a lot of y'all are suffering the winter effect, so I think we're gonna be okay. With us is also Kirsten McCudden from the Freedom of the Press Foundation, and specifically to present here the results and comment the results of our survey from her role at the U.S. Press Freedom Tracker. Hello, Kirsten, and welcome.
Luisa, thank you for having me, Dagmar, everybody. I'm pleased to be here and excited. Congratulations on launching the report today.
Thank you so much, and we'll can't wait to hear your comments. And our really good friend and also really treasured collaborator, Joe Ruiz, who was an integral part of the design of the survey and also of the editing of this phenomenal report. Joe, welcome. Thank you for being here.
Thank you for having me, Luisa and Dagmar. And Kirsten, it's great to meet you. And I look forward to hearing what you have to say about this. But really look forward to putting into action the work that MDRnet has been doing for the last few months and putting the survey together and giving us a compass where we need to go to help journalists in this country.
Thank you so much, Joe. Well, maybe we can start. And without further ado, you know, it's absolutely essential to take a pause and to consider the importance of the understanding that the context in which US journalism is operating today, this very minute, is a critical context. A lot of the rights, a lot of the freedoms, a lot of the systems that were in place to protect, to care, and also to finance a lot of the work that media does in the United States are in flux. And this is one of the reasons why we decided to name this the survey or this report From Crisis to Care. We want to be able to be the most optimistic, the most positive, and as Joe mentioned it, the most action guided and the most action forward in presenting the results, and also further on the project solutions that MDRnet is going to offer to journalists across the United States. One of the main takeaways that the survey gave us, besides the fact of being bold enough to launch a national survey and ask journalists of all ages in all contexts and across 26 states in the United States. How are you feeling? Tell us a bit about you, which we thought in the beginning was a simple question, and then we realized it wasn't easy at all. The main takeaway is that journalists in this country envision a future where mental health care, support, and community-based care is not just for the few. What journalists want in the United States is care as a professional space, care as a professional response to the way in which we do our work, and also the way in which we relate to one another in an accessible way, in a grounded way, in a trauma-informed way, and also definitely embedded in the fabric of journalism itself, from commissioning stories to the way in which we communicate what we do. Supporting journalists requires systemic solutions, and definitely and for sure, healthier newsroom cultures, leadership that is supportive. We will talk about the role of editors, the integral part of editors, as well as owners and publishers, in making sure that care is not only present, but also funded and also provided for. And definitely, we will not be able to build and we will not be able to provide care if there is not a community that is also not only feeling seen, but also receptive to the changes in culture and also receptive to the necessities that we will have in recognizing in each other vulnerability, but also a lot of courage. What did we do? We talked to a lot of people. Well, we didn't. Google Forms did, but we reached a ton of people in many different parts of the United States, rural, urban, north and south, east and west, in the middle of the country. And what we could find very clearly was not only a gender divide. A lot of the people who were responding to the survey were in majority women and non-binary folks, which makes us think, and we're not saying that male and cisgender male are not wanting to comment about their mental health, but there is definitely a bias in showing vulnerability and talking about things that women or non-binary folk feel more comfortable talking about. There's also definitely a very clear picture of the media landscape in the United States in terms of the races and ethnicities that answer the question. The majority of workers in the media field in the United States are Caucasian or white, and that was also represented in the surveys in their answers to the survey. Even though at the same time we also had folks who were Middle Eastern origin, African American, Native American, as well as folks who decided not to divulge their race or ethnicity. Asian Americans were also represented. The age range is very interesting. Nearly half of the people who answered were at the cusp of their career, 28 to 44. People are like in the full career train. And at the same time, 35% of the responders are in the moment of leadership, 15 plus years of experience, and in moments of critical pivoting in their professional advancement, noting, and I remember very well reading those answers, noting it is now in the moment of my maturity in my career that I realize how much help I have needed and how much help I need now, and how much this needs to be introduced in the way in which we do things. Key findings. You're going to hear me repeat this again and again and again throughout this year, because this survey is also the blueprint for the way in which MDRnet is going to operate and share its services throughout, conferences, trainings, participations, one-on-one coachings, and one-on-one spaces for mental health, empathic conversations. But this is key. the crisis is not individual. The crisis is systemic. And when we talk about systemic, we talk about especially financial instability, as well as lack of professional perspectives in the current context. Closings, layoffs, consolidations, aggressive mergers in the media landscape are affecting folks in the journalism profession in immense ways. It is also true, and it's also clear that mental health needs to be treated not only as an individual responsibility, but also as critical infrastructure for sustaining journalism and democracy in this country today. Yeah, only 2.5% of the people who answered the survey. We had 80 people targeted, very specific folks who were comfortable enough to answer a questionnaire that was quite long. It was 8 questions that were open-ended, eight questions that were closed. So you can imagine we did a lot of interpreting and a lot of reading. Only 2.5% people say, my mental health is excellent. What does that tell you? Well, what it tells you is that there are different levels of need, different levels of understanding, but that satisfaction in the profession is not a word that you hear very often, and that is concerning. 4 in 5 respondents say that they are experiencing burnout or chronic fatigue, and chronic stress in the past year has many, many reasons. It's connected to many, many factors. We sympathize a lot with reading answers of folks saying we do so many jobs at once. One single reporter is not only editing, but also taking photographs, is going on the field, doing reports, and also working this whole AI demands in the job. People feel overworked. There's definitely short staffing, and the resources are disappearing in front of our eyes. Today, in the United States, there's only 8.2 journalists per 100,000 inhabitants in the Union. Imagine that. The notion of news deserts is very, very clear. And so the question is, those who are in the newsroom need to cover even more and more ground. That is exhausting. The challenges that we find and that people are sharing with us during the survey are very, very clear. And you see, I'm not going to read the slide. You can read it yourself, and the report is published on our website, MDRnet.org. Everything is there for you to use and share, because sharing is caring. I just want to stop in point number 5. Isolation and lack of peer support. Almost half of the people who answer the survey feel lonely, and they feel isolated. And that, everybody, is something that we can affect and we can change today, because that ball is in our court. No money and no time for me is basically the slogan. We could have t-shirts made for that one. It is not possible to be able to feel that we can build a system that takes care of mental health if folks who are requiring it don't have access to it because they can afford it. They don't have time. Their employers don't believe in them taking time to take care of themselves. And also the providers are not culturally competent to provide the work. I'm sure that I'm talking to you who is listening right now to this conversation, and I'm going to ask you, how many times has a therapist or a counselor or a person who supports mental health told you, well, if journalism is such a demanding profession, why don't you quit? And that is not something that we want to listen. We don't want to hear that. What we want is for someone to say, we understand it's demanding. We understand it is hard. And we're here for you to build the muscle to be healthy and to continue in the profession, because that's what we want. A lot of people also talked about the lack of information. People don't know necessarily if there is help, and when the help is there, where to find it. So that's also another quest that we are that very, very conscious of. We're not going to take more time because we really want to hear what Joe and Kirsten have to say. But Uh, the main concern here is basically time, money, and meeting people where people are at. I don't think that another list of resources is solving the problem. When people are in crisis, the last thing they want is be looking at lists and clicking on a 100 links to see where someone can be, if there's a person on the other end of the line. Is it possible to provide therapy or counseling or coaching for free or at a low cost? Is it possible to be able to meet people where they are? And that is basically one of the questions that the survey was very, very clear about. The Media Resilience Network is proposing a structural change. And what we are proposing is, through our practice of culturally responsible and aware counseling and professional coaching for journalists, we want to be able to embed mental health in the fabric of how journalism is made. We are also training culturally responsive coaches and responders, as well as therapists, to be able to meet people where they are, and building capacity in the newsrooms for people to understand that this is no longer something that you can leave in the back burner. And basically, and thanks to Press Forward, we have the capacity, the means, and the resources to boost those systemic solutions, because that is always another of the biggest questions and problems. A lot of us providers of care support sometimes don't have enough funding to meet you also where you are. So today, we're meeting the problem face to face with resources, and that is really fantastic. I'm going to close now this presentation, and I would like to invite Dagmar, if you feel comfortable. I don't know if you want to talk to Kirsten first or Joe, or I'm just going to give you the mic, and let's move on. Thank you.
Thank you so much, Luisa, for this summarized presentation. Our report is already on our webpage. You can read it full. And we are on Vita-Activa's YouTube channel. We are live, so you can send us your questions there, or on our on our email, hello@mothernet.org. Please bring us your questions. And Luisa, if you would like to stop sharing your screen, so we have exactly all the people here on our screen. I would love to start with you, Kirsten. You have been following what's happening to journalists in the US for so many years. You are yourself a journalist. What do you see in this survey and this report? Can you give us your first comments about this, please?
Definitely. Thanks, Dagmar. Thank you, Luisa. Luisa mentioned a few times the word systems, systems in place, systemic issues, working towards systemic solutions. I'd say it makes sense that there's a connection between the report findings, journalists feeling burned out, financial instability, and intimidation from legal threats or harassment, all of which were mentioned in the report, and the trends in the data that we're seeing. So for a little bit of background, and Dagmar, I know you're familiar, the US Press Freedom Tracker documents mostly qualitative attacks on journalists and journalism. The number of assaults or arrests of journalists, how many subpoenas were issued to newsrooms, number of cameras damaged. So these numbers. We also documented when the Pentagon Press Corps walked out this year after refusing to sign a loyalty pledge. The lawsuit from the Associated Press for being booted from the White House Press Corps, shuttering of Voice of America, shuttering of Corporation of Public Broadcasting. Those are all just examples. Those are all 2025 examples, really recent. And, we talk to journalists like the survey. We talk to them day in, day out. And just last week, we heard from student journalists who, while covering college campus protests, they feel like they're putting their academic futures on the line and themselves at risk. So we're seeing this sustained, but also multi-pronged attack on journalism and journalists. the financial, the online harassment mentioned, also legal intimidation. So in short, not surprised by the findings. They're in alignment with what we've seen over almost 10 years of documentation in the tracker.
Thank you so much. And we will dig deeper into the patterns of aggressions of violence journalists are facing. And that, of course, are the reason or a structural cause for their emotional crisis right now. Joe, you were such an important person helping us to propose the study and then to edit this report. And Luisa already talked about the main findings, but what stands out to you and why do you think this report is important right now in this moment?
Honestly, the reason the work was important is we needed to hear from the people who want and need this help the most. You know, for years now, newsrooms and leadership and ownership groups have thought that EAPs and pats on the back were enough to help. And it's clear from the people who responded to our survey that that's not even close. And I do want to commend newsrooms who have taken steps to be better about this. I think one of the things that we can praise them for is, you know, in very horrible stories, one-off stories, violent crime, mass shootings, things like that, I believe our newsrooms are getting better about thinking about this. They're asking people, you know, cycling them off, asking them if they're okay, trying to get them resources. And that's great. I want to commend them for that. But what happens the other 300 days of the year? And I think that's what we heard a lot of from this survey is people realizing that toughing it out never worked. And it certainly doesn't work now. And I used to put that same pressure on myself too. And it's important for us to talk about this and for people to be open in their survey responses because we just need to know which direction to go. I talked earlier about, you know, needing a compass to point us in the right direction. And while there continues to be support for overall well-being, we've got to capitalize on this work so journalists can keep healing and doing the work that they're already doing.
Thanks, Joe. Kirsten, I'm going back to you. You already pointed on some of the patterns of violence and aggressions against journalists that the US Press Freedom Tracker has reported for the last year. We have a whole chapter about the environment in which journalists do their job and really the toll that telling the truth has for people who are working in this profession that is so demonized in these days. And journalists who are facing disinformation, every type of attacks, online attacks, physical attacks, distrust, and a lot of violence coming from many places, from official places and from public and from private places, not feeling safe at all anymore. What are the patterns that the US Press Freedom Tracker has seen and do you think will stay or even get worse in this year?
Ooh, that last part. I do want to touch on what Joe mentioned, which was about cycling off. And it's a great idea, right? When it can happen. It's not always possible for the journalists in the field. Last year, 2025, last calendar year, the US Press Freedom Tracker documented 175 assaults, physical assaults on journalists in the United States. And it's a large number. It was actually as much as 2022, 2023, and 2024 combined. And it's the highest number since 2020. So Dagmar, you asked about patterns, right? Let's think about 2020, 5 years ago, significant comparison marker here, right? That similar conditions, there was a global pandemic that created financial uncertainty for journalists, office closures. They were reporting on and from civil unrest, happened to also involve Minneapolis after the murder of George Floyd and also law enforcement at the time. We're seeing similarities 5 years on with how journalists are still, the conditions under which we're all still operating under. Another pattern from our documentation and our analyses is come back to this time and again, how routine news gathering is being criminalized. And, I'm thinking of, there's a journalist a few years ago in Chicago who received citations, was cited for asking too many questions. A journalist in California sued twice for publishing records received from a public records request. So he has to deal with the lawsuit in addition to his reporting work, right? And, definitely not the least of which, and possibly the most egregious of all, is last week's raid of Washington Post Hannah Nathanson, a reporter. She's not under investigation, yet the FBI raided her home, took her news gathering devices, her post-issued laptop, as well as her personal devices. And we have no confidence the government will respect journalist source confidentiality while those devices are in the government's possession. So we're seeing those are just repetitions, right? And types of aggressions against journalism, against the fourth estate. And when we're talking about mental health, you see it in the report, it's this, how these attacks are sustained over a period of years. The tracker is entering its 10th year of documentation now, right? That's 10 years. I think it's no wonder that a majority, more than 50, I think it was more than 60% of survey respondents together said they were stressed, depleted, or feeling worse than that, which was poor and in need of active support.
Yes, Kirsten, 10 years of reporting on all these violence types, it must take also a toll on you and your team, and you're welcome at MDRnet for a resilience clinic.
So generous, thank you.
And all the people who you're talking about, welcome. Look for us at hello@mdrnet.org, and we're there with you, not to give a solution to what's happening, but to talk to you, and so you can cope with it. So that's the most important thing. Joe, listening to Kirsten about all the things that are happening, how important is it to have a culturally competent response? Something that's not one size fits all.
I mean, the survey respondents told us, and that's what we wanted. Like you said, many of the resources available right now are generic and they're dismissive of lived experience. And while I don't think that's intentional, the lack of cultural competency is hurting journalists. And it's not just age, race, gender, it's flyover country. It's where we exist, where we work. Do we have people who understand what we're saying? I've lost count over how many minutes of therapy I've lost because I've had to explain some of the nuances of journalism and the work that I do and why I believe it's important. And when you're dealing with 50 to 55 minutes a week or every 2 weeks, like that's a significant bit of time where you can't get the help that you need. So what it is cultural competency includes the lived experience of people as it relates to their care and how they react to situations. And like you said, it's not something that can be done as one size fits all. Like it's great that we have these, basic level things like, oh, limit your notifications. I was talking to somebody yesterday about I don't visit a website anymore because the news was infuriating me. But it needs to be what happens after those first steps are taken, and there's still more work to do.
Thanks, Joe. I would like to go now to the positive note. We are a tough species. We tough it out, but we are also there to do what we're really passionate about that. Kirsten, what kind of resilience examples have you seen during this 10 years of documenting cases and being witness of journalists really saying, I stay here and I will tell the truth and I will be a pillar of democracy?
Dagmar, I have seen a few. I also, though, want to pause and just tease Joe for calling it flyover. I worked at the Kansas City Star and Kansas City PBS. I love the middle. It's the best. Just kidding, Joe. So resilience-wise, what's been really fascinating working for Freedom of the Press Foundation, nonprofit organization that houses the tracker, is that we've seen a sustained interest and demand for our digital security training team. And journalists are more and more becoming proactive about protecting their digital sources. And there's a connection here, which is, their cells, laptops, and protecting by extension sources. Our trainers year over year are seeing an increase in a request for help. And that is what that is. And that's one way, it's a resilience action when you think about it in the terms of control the things that you can control in a manner. And if you think, I can do these things, I can get training and feel better about how I am as a journalist, whether I'm in the field or somebody comes into my home or I drop my phone, it has sources on. That was a really interesting pattern over the years of journalists being proactive. And I think it's going to continue protecting where they can protect in that. And, I would say the other actual resilience strategy is acknowledging this environment. We're all doing it right now. I will say 10 years ago when the tracker launched and was beginning to launch and was setting out to document the state of press freedom in the US and what was happening, there was a reluctance among journalists, not always, but sometimes we'd have to convince someone to go on the record to be documented in the tracker. Maybe they were denied access to a government event that should be open, or broadcaster doing a stand-up and just gets shoved by somebody walking by. And, it wasn't uncommon to hear more so years ago, I don't want to be the story. I don't want to be published. I'm afraid of retaliation, possibly, or I'm a journalist, I'm on this side of the camera, not on this side of it. And it's understandable. I think many of us feel that and understand and are journalists in that way. But we're hearing that less so. Now that the tracker, 10 years of it, not only, you can call it safety in numbers, it's one way of looking at it, but I also think of it as validation for journalists for what's going on in the United States. And sometimes it plays a role in accountability. And to me, that's a resilient strategy, the acknowledgement of what is happening.
And also knowing that you're not alone. That's not happening
Yes.
only to you. That's not your fault, that it's systemic, and that there are organizations there to support you. Joe, from the report, what's the most positive aspect you can highlight?
Well, first off, I got to shout out Kansas City because I spent 2 years there myself about a decade ago.
Amazing.
So shout out KCMO and KCK. For me, the things that I'm going to take away from the report are that people are desperate for good, relevant, and expensive help. And newsroom and leadership need to take this seriously. The positives I'm going to pull from that are one of the things we highlighted, I believe, in section 4 of the report, is that age and rank matter in this. And that means managers and leaders, whether you have the title or not, we have privileges that others don't, particularly younger journalists, particularly early career journalists. We can and should be speaking more about mental health and well-being and making our newsrooms more comfortable talking about it, either openly or with each other. So for me to see that many people responded, that's a good sign. That tells me that people are thinking about it, not just from their own perspective, but paying it forward. What does this mean for the 8 journalists, the 8 reporters that I oversee on a team? And it's not just about how it affects us today, but it's what the work we do with these younger journalists, people who come behind us, mean. If they don't have to go through the same things we all did and that we're going through now, then we're better for it. And that leads me to something that Kirsten mentioned in her first answer, was thinking about it from a student journalist perspective. I would love for us to be involved in J schools and teaching people that, the old ways, they never worked, even though we like to say that they did. And in fact, speaking of Kansas City, that's where I had my change, because I used to be the one who would try to toughen it up or take on things that my reporters, I didn't want them to have to deal with because they were fresh out of college. I would take on the stressful work. And that wasn't great. Like, it's commendable, but it's not right. It's not right. And so I think for me, I really want to see newsroom leaders, particularly people without the title, but people who have influence in the newsroom, take this more seriously, speak openly about it, allow others to feel comfortable speaking with it to you, whether it's in, the newsroom setting like I've had in the past, or where people have approached me afterward and say, "Hey, I really am glad you talked about this. Like, what can you help me with?" By being more open to that and getting those survey results, that's the positive I'm taking away from this, is that we're thinking about this more deeply than just here's the number to the EAP line, here's a pat on the back for you. Let's bring in a puppy. I love dogs, I love puppies, but that's not necessarily what's going to get me through not only the crazy stories, but just the relentless drumbeat of news that we're facing right now.
Absolutely, Joe. Thank you so much, Joe and Kirsten, for your comments and for taking the time and the love to share with us your impressions about the report and your thoughts. Going now to Luisa. Okay, Joe already talked about the students and the need of being young and knowing that talking about your emotional crisis or what you're going through is important when you start at school. Luisa, what are the services MDRnet will provide?
Yay. And shout out to Kansas City and shout out to puppies as well. The wellness culture is fine. Wellness culture is fantastic, but wellness culture is a temporary solution. We're talking about something that's a little bit more long lasting. So what is MDRnet going to do? And you have it all in the name, as a resilience network, but we're trying to establish our communities of practice, spaces where you can talk to people that you feel affinity with. It could be topical, it could be ethnic, it could be racial, it could be gender, it could be, I'm absolutely obsessed with climate change and climate anxiety is a very, very big problem in journalists and freelancers, especially who are covering the climate. But I mean, let alone elections, you name it. Community spaces where people can share and also where people can understand that isolation is never, a good idea. We're going to also offer culturally competent spaces for people to have one-on-ones and explore the trauma that is connected to particular events. We're not providing therapy. We're not providing long-term solutions. We're providing people with the tools to be able to also gain the strength to become their own advocates, to become the people that are able to ask the questions that they need, to put forward to their managers what kind of relationship they want, not only with management, but also with the public and with their colleagues. And last but not least, we're super excited. We're going to come to you. We're going to come to you, to your newsrooms. We're going to come and share the fantastic good news that we probably don't have the answers. We hardly ever do. But we are very, very, very open to talk with you about how to build better connections. Joe mentioned the cream of the crop. We want to talk to people when they're young. We want to help people when they're senior. We want to engage in conversations with those who probably are the most underserved and the most underrepresented in those places where mainstream doesn't get to, in the places where, and I talked about the news deserts, the places where we don't even think that the solutions are possible because we've never had solutions. So that's what we're going to offer in this three-prong approach. Again, thanks to the press forward support, is going to be completely free of charge, completely confidential. And those are very important aspects of the work that we do.
And when will we start?
Oh my God. So, drum roll, February 10.
Okay.
And I mean, just imagine if the Night Media Forum was a volcano, we will be in the skirts of the volcano of the freedom of the Night Media Forum in Miami on February 10th 10:30 a.m., we're going to have a breakfast conversation live with real people. We're going to show you what modeling looks like, what asking for help looks like. We're going to talk about vulnerability. We're going to talk about the moral injury of this whole aspect, but we're going to do it in our own terms and using our own language. So everybody's welcome. We're going to put a QR code at the end of this streaming so that you can register if you're going to be in Miami. It's going to be a pleasure to see you there.
And of course, you will find us online because there is where we will meet most of the journalists. I think we have done with our conversation, Luisa. Thank you so much. And of course, we have to thank our great Ana Arriagada, who has helped us with the technical details. Connie, Constanza, who helped us with the design of the report.
Constanza
Figueroa and Giselle Sanchez for the communication. So thank you all the team of Vita-Activa. Vita-Activa is our home. That's the main organization where MDRnet is a project of. So thank you so much to all of the team. Luisa.
And thank you to all the people who responded. I don't know if you're watching, and if you're watching, that would be amazing. Send us a note, send us a comment, send us an email, hello@mothernet.org. Thank you for having believed and trusted. And on a sentimental note, because you know that we are all hard, these too shall pass. Everything passes, and together, strong and committed, we will withstand any harsh weather that will come our way. Thank you, everybody, for this. Dagmar, amazing presentation, and we will see you all on the other end of the line. Thank you very much.